Okay, these are the exercises and drills for the adductors, the glutes, and the external hip rotators, which is the what we would call the rotator cuff muscles of the hip. And we are going to start with uh, doing the obturator um, nerve glide, which are the nerves that's the nerve that innervates all of the adductor muscles. So if I'm doing it on my right side, you would be doing it on your left side. I'm just showing you, demonstrating it on my right side. So my right knee would be in that position, where you got a little stretch through here. I would side bend away, I would rotate away, and then I would flex like that 5 times. Not too much work. You don't want a tension of no more than a 3 on a scale of 1 to 10. The next one is going to be for the lateral femoral muscle, nerve, sorry. So again, you're doing this on your left side. I'm demonstrating on my right side. So the working leg is this one. It's down here. I take my opposite leg, cross it over, right? Cross it over, and you can use a chair. So I cross it over, then I side bend away from that leg, rotate away, and then I do that 5 times. Again, no more than a tension of 3 to 10. Now we're going to move on to the hip rotators. Okay, so now we're going to go to the hip rotators. And these are part of the rotator cuff of the hip joint, if you want to call it that. So you want to focus, this is your trochanter, right there at the top here, and on the tuberosity on the lateral side. So the what you would call the posterior superior area of the trochanter and the lateral edge of the tuberosity. So what you're going to do, the stretch looks like this between these two spaces. You bend the knee, internally rotate to create more space between the two. That's all it is. And then the contraction is there and external rotation. And you feel that contraction between those 2 points. So it looks like this, the full movement. You go up, internal rotation, external rotation. That's for the hip rotators. Now we're going to continue with the glute maximus, and it looks like this. So you're going to do the stretch, the stretching part. You're going to hip extension, hip abduction. So we have two sets of fibers to begin with. We got the lower fibers and we have the upper fibers. So you're going to see two different stretches and two different contractions for the hip fibers, for the upper fibers and the lower fibers. So let's begin with the lower fibers we're going to start with. So the lower fibers look like this. Hip flexion, internal rotation, and abduction. That's for the lower fibers. And the contraction looks like this. External. First, you want to set your pelvis in a posterior tilt. Keep it there. External rotation, keeping your pelvis square. Extension and adduction. That's for the lower fibers. So it will look like this. Whole exercise. Up, internal rotation, abduction, then come straight from there. Lock the knee, externally rotate, and abduct, keeping your hips square. And you there, and you keeping your hips square, and you're coming towards the midline. That's for the lower fibers. The upper fibers is the stretch, hip flexion, internal rotation, abduction, and the contraction is external rotation, knee locked, extension, and abduction. So you're taking your foot away from your body in extension, keeping that posterior pelvic tilt. Now the whole exercise looks like this. Up, internal rotation, adduction, lock the knee, external rotation, keep the hips square, extension, posterior tilt, external rotation. So that's for the glutes. Standing. Now if we're going to do this lying on the floor, in a prone position, like this. So first thing I would do is to push my pelvis into the floor, externally rotate, extend, bring it towards here. That's the lower fiber, and taking it away, it's the upper fibers. That's doing it prone. Okay, now we're gonna the last one, I wanna just add this one for the anterior fibers of the glute medius and the posterior fibers of the glute medius. So the stretch for the posterior fibers looks like this. You're going to go up, out, internal rotation, take it across abduction, and a anterior pelvic tilt. And then the contraction is bringing it back, external rotation, abduction, and a posterior pelvic tilt. So up, flexion, internal rotation, abduction, anterior pelvic tilt, external rotation, abduction, hip square, posterior pelvic tilt. That's for the posterior fibers. Now for the anterior fibers, you would take the leg, working leg back, external rotation, take this other leg across, and then you do a posterior tilt, and you get a stretch. Then for the contraction, it's up, internal rotation, up, internal rotation, take it away, and an anterior tilt. And that's the glute medius. Posterior and anterior fibers. The last one we're going to do now is show you using a bridge to work both your glute fibers, both lower and upper. So I'm focusing on my left. I make sure I externally rotate my hip. I take it away in the bridge. I'm working on the upper fibers. Then when I bring it close, I go up. I'm focusing on the lower fibers. So those are the two hip positions: abduction, upper fibers; adduction, lower fibers. And you can do that, hold the bridge position up to 30 seconds at a time. Do 3 to 5 reps at a sitting. And those are the exercises.